Hello, Mr. Collett.
Yeah.
Dr. McDonald, nice to meet you. I understand you've come back to clinic to discuss your previous treatment and current treatment for...
Yeah.
And how much do you understand about your condition at the moment?
Well, I know that it's, it's progressing and that it's terminal.
Right.
And I know that everything we've tried isn't working.
Right.
And, I want to know why. I've been doing my own research, into different drugs, looking at the internet, talking to different people.
Mm-hmm.
I know there's something out there, I'm sure you've heard of it, it's called Avactin, okay?
Yeah.
And by all accounts, sounds to be like the perfect drug for me, and that it's going to give me, 12 months extra, and I don't know why. I'm annoyed that it's been me that has had to find this out. Why the hell didn't anyone tell me about this?
Do you want me asking about how you found out about Avactin, or where your information...
It was basically, it was just, on the internet.
Right.
And it just seems to be really offering for people like me that aren't responding, an extra sort of 6, 8, 12 months of life, which, which is all I can ask for. It would be fantastic if that could happen. Mm. And no one said it, and it's taken me sitting in my bedroom, Googling to find this.
We've not met before, so it's hard for me to say about your previous consultations why this drug wasn't discussed, but probably the main reason would be that it's not a drug that we have routinely available yet in this country.
Right, but I know it's available in the States, it's available in Germany, it's available in Belgium, in the EU, a lot of places it's completely available, and because, I guess, for one reason, because it bloody works,
The way the new technologies or new drugs like this are assessed in the UK and the NHS is that the effectiveness of the drug is looked at, and as you say, there is data and there's evidence that this drug can prolong your life, and that it can, and especially in cases like yours where you haven't responded to other forms of chemotherapy, it can be effective.
Yeah.
Not in every case, but it seems to work on those grounds. The other factor that the institution that assessed these, have you heard of the National Institute of Clinical Excellence, or NICE as it's usually reported in the press? Their job essentially is to weigh up how effective it is in terms of response rates and so on, but also how much it costs. And the sad reality of assessing these drugs is that often the newer the drug is, the more expensive it is. And NICE have a cut-off point at which they cannot fund a drug if it's going to cost more than a certain amount in terms of the amount it costs to give you an extra year or to delay the progression of your disease by 6 months or a year. Does that make sense? So it's a cost-effective analysis.
Well, okay, it's cost-effective, but to me it's 12 months of my life. It's just so it's that they're not making it available, you're saying?
I understand that that's no comfort to you at all, and the way they make these decisions is it's complicated and it's open to lots of debate. So they not only have to make an economic analysis of how much it would cost, which is open to error and several assumptions, they also have to make a judgment about the actual quality of the life you'd get from extra time, from keeping your tumour at bay from progressing. And both those things involve assumptions and subjective judgments. And you and I could have a very long discussion about the merits of the way they do that. And I suspect that we'd agree on lots of the things about that being faulty. And I expect people at NICE would agree that there are lots of things about their process which is imperfect. And ultimately, at the end of the day, it's based on a rationing decision. It's about money.
So ultimately, I just have to sit tight. No, I can't take something that's going to mean I can spend 6 months longer than my children, and just basically accept it. Is that essentially what I've got to do?
That's not entirely what I'm saying. What I'm saying is that this is a decision that is made at a high level by experts in the field, and they make a judgment about whether this is an affordable drug for the effect that it gets. So if it's not very effective and very expensive, then they won't fund it, and they've made that judgment about that. So to some degree, in terms of me being able to give you or prescribe you a course of therapy on the NHS, then our hands are tied from that point of view, which is, I'm sure, knowing about that process is not comforting at all, and it's frustrating. It's frustrating for your doctors as well as it is for you.
But so what can I do?
So the evidence suggests that this drug can be effective in people in your situation, and instead of, I think, to try and to focus on the nice decision would probably not be productive. So there are experts in the field who will challenge or appeal that decision. But for you, from your point of view, trying to get you the best therapy is, I think, what we have to focus on. Although NICE haven't approved this medication to be licensed for use for this, there may be a means whereby we could get you treatment. The primary care trusts, who ultimately control the funds for therapy, will sometimes consider therapy on a case-to-case basis. So
right.
we could apply to that, or I'll ask my consultant if we could apply for that. And they're also, often with a new drug like this, they're often long-running trials for people with your condition.
Right.
And we may be able to find a means of getting you involved in a trial. Of course.
So this bypass is NICE?
It's not quite as simple as that, and I wish I could say to you, don't worry, there's another definite way that we can get you this treatment, because I'm afraid it's not certain. But for example, a trial, they often require you to be randomised into different groups for your treatment, so you might end up having a placebo treatment rather than the drug itself.
Yeah.
And the PCT decisions are unpredictable. You don't know whether they'll be able to NICE or not. So I can't, unfortunately, say to you, I'm sorry, this drug's not available on the NHS, but we can find another way for you, definitely, because I can't be sure that we'd be able to deliver on that.
Just 6 months is, to me at the moment, is literally everything. It would give me 6 months longer with my children, with my wife. I'm, for all intents and purposes, I'm feeling good, physically.
Yeah. And
to keep that going for another 6 months would make such a difference, to me and to my family.
I understand that. I think that where we need to go from here is to arrange another appointment with a consultant who will be able to give you more information about what's happening with the NICE decision and any appeals that are being made to that. We'll know more about the trials that we might be able to get you involved in, and we'll be in a much stronger position to make an application to your primary care trust to try and get funding for this drug. The law is changing in the NHS to the degree that you can top up your funding of NHS treatment. I'm not suggesting that this money should come from you personally, but if we find another means of funding it, then it wouldn't preclude you from normal NHS care at the same time, whereas previously it would have done. So in a way, there's a little bit more flexibility built into the system for people like you who have a condition that is we're just beginning to develop new treatments that are slightly more effective than the old ones, and yet there's a time lag before these become affordable and cost effective, which is, I know, a very clinical and bland term for you, but it's just that the reality of working in an organisation with limited funds that have to be rationed is just that they have to make these decisions. And I know that's no consolation to you, and I understand entirely that you're focused on the amount of extra time, symptom-free, that you can get.
Yeah.
So I'm sorry that's more disappointing news after having the bad news about your scan last week. But we will make a plan to meet again with the consultant as soon as possible. I appreciate time is important. And we can do our best to see about how we might get you the most effective treatment. Because that's what we both want.
Yeah.
Okay. So we'll make an arrangements right away to bring you back in a week's time and see your consultant.
Okay. Thank you.
I mean, do you? I mean, is it clear to you why that decision?
Yeah, I mean, it makes sense.
Or anything
But
else you wanted to ask about?
It's my life, isn't it? You know? But thank you.
So we'll see you again next week with the consultant here. Nice to see you. This scenario gets right to the heart of a difficult ethical dilemma between the utilitarian concept of providing the best treatment for the greatest number of people and the doctor-patient relationship in which the doctor wants to pursue the best possible treatment for his patient. It would be very easy in this consultation to get into an argument or discussion about the merits of the NICE decision-making process, and that's not the purpose of the scenario. So there are a few pitfalls that need to be avoided. Apart from getting into a debate about NICE and the way they make decisions, it's also very important not to try to belittle the effectiveness of the treatment if that's not the information you've been provided. So it'd be very tempting to play down the effectiveness of the drug to get yourself out of a sticky, difficult discussion. It's also important not to focus on the NICE decision but to make plans for how you might get the patient the best possible treatment. But at the same time, it's very important not to guarantee that there are other means of doing so. There are usually two avenues to explore. One is applying to the PCT Trust for extra funding, and the other one is looking into medical trials, but neither guarantee that the patient will get the drug at the end of the day. I think all you can do in this scenario is explain very clearly how the NICE decision is made and make arrangements for the patient to come back with a senior person present who can make decisions about where to apply for further treatment.